Good morning, everybody, and welcome. My name is Inon Elroy, and I'm the head of the Israel Economic Mission in New York. On behalf of my partners, the Israeli Economic Missions, the embassies, and the consulates, and the Israeli Export and the Cooperation Institute, I'm excited to welcome you and to open this very important and timely webinar. As the coronavirus continue to spread and impact all of our lives, our thoughts are with you and with your families at this time. I also wanted to express our deep gratitude to the entire healthcare community, to the essential workers, and to who are in the front lines working tirelessly to save lives. We're thrilled to have with us today Assaf Barnea, Chairman of Life Science Advisory Board at the Israeli Export Institute. Assaf is also consultant for the World Bank and CEO of Sanara Ventures. And today will share with us the way he sees Israel's digital health industry, uniquely positions for the challenges of the global pandemic. Assaf will also speak on the role of the Israel Innovation Authority and platforms for bilateral cooperation like the Bird Foundation. Finally, he will present his view as leading investors during these times. We will also be hearing from CEOs of 5 Israeli digital health startups who will demonstrate how their solutions are being utilized to address COVID-19. Before I will invite Tomer Epstein from the Israeli Export Institute, I would like to share with you also that Israel operates 44 economic missions globally. We are all non-for-profit offices aimed at bringing together Israeli companies and global partners. Today's featured startups are only examples of Israeli technologies that can help you to provide better and more efficient services to your clients and patients. You're welcome to reach out to us from the country that you're based and to explore thousands of Israeli startups and companies offering innovative solutions. In addition, please feel free to visit our global website for more information, which I will share with you later. Tomer, I want to ask you, please, the floor is yours.
Thank you very much. Thank you very much, Inon. And also thank you all for joining our Digital Health Nation COVID-19 response webinar. My name is Tomer Epstein from the Israel Expert Institute, and I lead the medical device and digital health sector. The coronavirus has really caught us all by surprise and really changed the landscape in all areas. Until a couple of weeks ago, the digital health sector has been struggling to scale their products and innovations, and healthcare organizations have required massive clinical evidence and validation, need to locate specific budgets, and find early adopter physicians. But the effect that we see now is unprecedented in terms of market acceleration in the adoption of technology across all healthcare systems, government, and hospital. The strict measures on social distancing, self-isolation, and the need to accurately monitor and diagnose patients has resulted in new virtual ways of clinical work and operation and opened widely the possibilities for remote care technologies, decision support tools, and point-of-care diagnostics. Many companies in Israel have worked quickly to adapt their solution and added features to cope with COVID-19 response. Today we'll have the chance to taste and feel few of them, but feel free to reach out and explore more. Our first speaker is Assaf Barnea. Assaf is the CEO of Sanara Ventures and the chairman of the Life Science Advisory Board of the Israel Expert Institute. So Assaf, you can go ahead and start. Thank you very much all, and enjoy the session.
Thank you. Can you hear me now? Cool. Just to put things in place, I'd like to share with you a short presentation that I built specifically for that. I want to make sure that you can see it. Is it on? I'm just checking to see if it's on. Is it? We're good. So I don't know if you know, but back in 2017, this was the very first year that Israel has crossed $100 billion in export. This was an achievement that later on was increased. And back in 2018 and 19, I think we have crossed to be over $114 billion in export. This is in total areas, not just obviously in life science, the life science component out of which was about $9 billion. So it is meaningful, but as we see it in the Export Institute and the Ministry of Economy, this is not enough. We feel there's a great opportunity, specifically in digital health, and I will try to share with you some of our thoughts, and specifically some of those that are related to COVID-19 crisis and opportunity that comes along. First of all, while the COVID-19 is taking place now, and even though in Israel it started to a little bit phase out and we feel a little bit less tense, most of us have gotten back to work. The pandemic is in the midst of taking place in so many other places. What we felt in the Export Institute, there's a theme that we're pushing now very strongly is, despite the difficulties, despite the challenges, the main theme for us is business continuity. This is probably going to change. We shall not obviously meet maybe in months or two or few months even in face-to-face meetings, flying overseas and meeting face-to-face like we used to do. But luckily, and through Zoom and other applications, digitalizing our life, this is something that we feel that we have to make sure that we keep communicate with one another and maintain those relationships that we have been building as part of the Israeli business opportunity, as part of the Israeli government, and make sure that the business continuity keeps on. Specifically in those times, it is a must do. In order to make sure that we execute those business continuity concepts and themes, just in the last months and a half or so, we have conducted within the Export Institute, and a great job that was done by TailorMed and the team, and Angela and the team in the Export Institute. We've been holding about 20 webinars in the last 6 weeks, those that are related to North and South America, those that are related to the Asian market, those that are related to the European market. We've presented about 140 companies to different partners, potential partners and investors in the last 6 weeks. This is an ongoing mission that we're trying to push through, specifically now when the companies are desperately looking for additional capital, when the companies, startup companies, mainly which the Israeli ecosystem is built off, looking for partners and capital that could support these difficult times. Among which we have built a specific catalog in the third bullet that you can see in my slide, that is basically brings about 70 companies with not necessarily tailor-made solutions to COVID-19, but definitely the related solutions of COVID-19, some of which are very specifically focused on that, and some of which are related to those general challenges that we shall be facing, the inability of people to get to hospital, or the unwillingness of people to get to HMOs and others, and potentially be exposed to the pandemic or other issues. So there's a total mind shift, there's a total paradigm shift in the way we on this planet going to deliver care, and healthcare will be dramatically changed. Telemedicine will definitely be an important tool for remote telemedicine and remote medicine, as we've been looking into those of us in the last few years. Now it's got to be a tremendous catalyst through that crisis. And I think the adaptation or the willingness to purchase by the healthcare providers will be taking a much bigger place than it used to be before. Even within the Israel Innovation Authority, which is under the Ministry of Economy, we have just designated about 50 million shekels, which is, it's not enough maybe, but it's definitely a significant amount of 50 million shekels, which is a bit over $10 to $15 million, which were injected to a lot of projects which were submitted to the Innovation Authority, COVID-19 related, only COVID-19 solutions, pilots in hospitals that were subsidized, including some of our companies in Sanara Ventures, and one or two I shall expose and share that with you. So altogether, there was a true effort by the various ministries and organizations within the healthcare ecosystem in Israel to support the companies and make sure that locally and globally, we are continuing to do business with you guys, with the partners, strategic partners, investors, healthcare providers, and others, to make sure that we're trying to do the utmost to maintain those relationships that we have been built throughout the years. This catalog that also was mentioned by Tomer of those 70 companies is basically presenting care coordination companies, is presenting infection diseases, intensive care unit related solutions, point of care diagnostic solutions, risk assessment, and obviously telemedicine under one catalog that will be distributed in the next, I think within the next few days will start to be distributed, but it shouldn't be an issue to get one and to expose more and more potential buyers, healthcare providers and others to this unique solution, bouquet of solution from the Israeli industry. Part of those solutions, or major part of those solutions, obviously will be related to digital health. As you may know, under the Israeli government, about 2 years ago, digital health was defined as a priority, as an engine tool, if you will, to support the Israeli economy, and $300 million were injected on behalf of the Israeli government to support various solutions in digital health. We are considered to be the second largest hub of innovation outside of the US, with about 500 companies, startup companies, even more than that, some of which you can see in this map that I'm just presenting now, which was set up by the Startup Nation Central, which is a national effort to expose and build collaboration with the global companies to the Israeli ecosystem. But this is just one of many of those companies and maps that have been trying to outline the various solutions in various fields. You can see some of the companies that some of you may have been working with and others, but the focus on digital health as the next revenue generator for the state of Israel was decided 2 years ago, not just because of the startup community, but also because of the fact that Israel had, for the last 30 years, electronic medical records unparalleled to so many other countries that have been doing paperwork. And Israel happened to be one of those very few countries that 30 years ago started to computerize and built up big data databases for electronic medical records, if you will, in hospitals, in the community centers and others. And this is a true base for exploiting that data to come up with more solutions, related solutions. All in all, when we are talking about having over 500 companies with electronic medical records and the government support and dedicated incubators and active investors, HMOs, 4 HMOs for the 9 million people that are living in Israel. So the industry is very centralized, which help us to negotiate, get to the data much faster, and come up with solutions which are related to COVID-19, but not just. A little bit of what I do on the day-to-day is Sanara Ventures. Sanara Ventures is a VC incubator which was created as a joint venture of Philips and Teva Pharmaceutical. At the moment, we have 16 portfolio companies, and as an investor, one of the things that we did the last couple of months is really making sure that some of our companies, some of which were related to COVID-19, or I would say easily pivoted to COVID-19 solutions, and some we've been trying to, not in an artificial way, but rather really make sure that the next year or two, they shall have some kind of inclination or understanding of what their solution might be related to the nearby solution, but rather also to incremental potential evolutions of various solutions that will take place in the healthcare ecosystem. And as such,
just a second, please put your slides on full screen.
Yeah, I am on full screen, at least in my desktop.
You should just be sharing the other screen and not this one. And this is how we will see the full screen.
Is it better now?
No, you should change it in Zoom. The screen that you're sharing.
Let me try. Yeah.
It's better like that, Assaf. Go on, please.
Okay.
We may have 5 minutes.
Yeah, so I apologize. Yeah. Well, basically, some of our companies that I'd like to share, one of which is TailorMed, which Strulik is here, Strulik Dvorsky is here as the CEO. It came out with a nice solution regardless to the COVID-19, but it's obviously very effective to the COVID-19 as addressing a true need in what is called the financial toxicity with a solution which is a financial navigation for cancer patient, but not just for cancer patient. You can see here one of the press releases that was made by the company, by TailorMed, which Srulik, the CEO, will elaborate later on, expands the way of healthcare providers to maintain revenues and reduce patients' financial burden during the COVID-19 crisis. So this is something that I shall let to Srulik to explain. Another solution that we have invested in called My Home Doc is a device which is based on the smartphone. It has 4 sensors, some of which, or I should say 3 of those, a pulse oximeter, a stethoscope, and a thermometer are very relevant to corona patients and looking into potentially deterioration of those, the inability or the respiratory challenges to breathe. And it's based on the smartphone with a whole solution of the application that runs on the smartphone, guide you as a patient, what you can do from your home. And this is something that we need to understand. There will be a big transition from delivery of care in hospital to the community and to the patient's home. One more thing that I'd like to emphasize before I conclude is the fact that it's a must do on my end to look into the collaboration that we've been doing quite significantly under the open innovation concept, building up partnership, and also stepping into a knowledge sharing, more and more knowledge sharing. Whatever the benchmarks that we've been seeing, let them be in Singapore, let them be in South Korea, let them be in the United States or in the South American market, we need to come up with mechanisms, both technological means, as well as the understanding that we need to collaborate, making sure why such and such people under such and such research have such and such limitations or potential to recovery under these circumstances or another. So this is a must do. One of the mechanisms that I like the most is a company that is called Induct, which is based in Norway. And they came up, I think like 5 or 6 years ago, regardless of the COVID-19 solution, regardless of the COVID-19 crisis, with a solution that is related to open innovation community, being able to share solutions that were implemented in 1 hospitals with 83 hospitals in Norway through that unique internet or web-based platform. This is just to illustrate something that I think more and more will now get a push. You can see some of those solutions that came about from a specific hospital in one of those regions. And once it was implemented in one of the hospitals, 83 other hospitals in Norway were able to see and adapt. There's no need to create the wheel over and over again and to come up with solutions that you need to invest so much money. This is, for instance, even prior to the COVID-19, the ability to reduce cancer diagnostic, breast cancer diagnostic in the Oslo University Hospital from 12 weeks to 1 week, which is a dramatic change. Once this was implemented in the Oslo University Hospital, later on it was shared by this group of hospitals that you can see in Norway. I think that example of the Induct platform and the others is something that we have to take a serious look into that, how we built up those mechanisms, let them be partially Israeli solutions and some of which that you can find in the States, but really get into the ability of knowledge sharing into much bigger depth than we used to do till now. It is a must do. It's something that will make sure that there's a true push to those solutions and channel them despite the conservativeness and despite the opportunity that will be created under the COVID-19 crisis in a much faster way for commercialization, for knowledge sharing, for open innovation, and for much more effective partnerships. So with that, I would like to end, wish us all, that this crisis will pass on, and hopefully we shall come back to do business as soon as possible. Thank you for the attention.
Thank you very much, Assaf, for the insights and the presentation. We would like now to move on to the tech session of today's event. Just a note for the companies, please keep on time, 5 minutes. And for the audience, I really encourage you to ask questions about the technologies, about the companies, and the companies here can answer live, or you can exchange email for later discussion. So the first company is Diagnostics Robotics. They developed a home-based triage system to assess and monitor individuals at risk for COVID-19. So we have here Dr. Kira Linsky. She is the chairwoman of the company to start and to share a presentation. So Kira, you can go on. You can go ahead.
Thank you. So Diagnostics Robotics is a company who's been focusing on building clinical triage systems. We've been basing our predictions based on 100 million visits inside either primary care or emergency departments, building clinical triage and navigation for patients in hospitals and in primary care, working with 75% of the HMOs here in Israel and being delivered in the United States to millions of people. But 2 months ago, when COVID happened, we've been asked by the Ministry of Health to extend our clinical triage system to also monitor and triage for COVID-19 for all of the citizens of Israel, 8 million patients daily. Since then, we've been working with all of the HMOs, Israel 911, and hospitals. What we've been providing the Ministry of Health is an epidemiological map showing them where COVID is right now, but most importantly, applying machine learning to actually predict how it's going to spread. We use this by using lots of open source information, but mainly by delivering our clinical triage to all of the population of Israel. Every day, every person in Israel is getting a text message with a link. They have to fill in their symptoms. At the end, the system can give them indication of risk. All of this is, of course, anonymous and creates the epidemiological map. There's also an option to apply the system in a not anonymized form. In other words, if the system predicts using our machine learning algorithm that a person has a high probability for COVID, a red flag will be sent to their provider. So summarizing the process, either I'm just a worried well and I'm trying to get to 911 and I'm doing self-triage, or I'm being monitored by getting a link on a daily basis. We all get to a dedicated landing page, fill in a clinical triage around COVID. If the person doesn't have COVID, they have an all-clear recommendation, but if they do, they're being asked to contact the call center. And if applied in not anonymized form, a provider will get a note and treat the patient. But the most important thing is that for the Ministry of Health, we provide them this epidemiological map. This epidemiological map is enabling the governmental agency to make decisions predicting which cities needs to be closed, and during the exit strategy that Israel started right now, which ones need to be relieved to prevent the second wave as well. Additional resource allocation has been done using this system. For the population, it increased adherence to public health guidelines, and for health system, it's mostly about reducing loads in call centers, but also by protecting the safety of healthcare personnel by moving triage to online platforms. 20% of the population of Israel fills in the clinical triage on a weekly basis. 83% of them finish the questionnaire from beginning to end. We provide them for each city 3 measurements. How many people at the city self-reported they've done a COVID test who came back positive, and the numbers, the Ministry of Health, of positive COVID tests. And this is the predictions of the system. This is one of the Orthodox cities closed very early on. Here we see a very high gap between how many people think they've done a COVID test or came back positive and the numbers of the Ministry of Health. This is coming because of a lot of private testing, and the city was closed very early on due to our predictions. On April 4th, we were allowed to publish once our predictions. We published 3 cities, and indeed, the government has started doing COVID tests, and 2 days later, they've been discovered to have a very high COVID percentage of the city and has been put into closure. Since then, on a daily basis, the Vice President of the Ministry of Health is using this system for quarantine decisions and resource allocations. This is the story of 2 cities. In both of them, we learned approximately in the same time that the symptoms are growing. Here, the intervention was very low. They increased the COVID test by just a little bit, and you see that the graph continued growing exponentially. Here, on the other hand, they increased COVID tests significantly, almost flattening the curve. This system is also allowing us to identify new symptoms. Very early on at the disease stage, 2 months ago, our system discovered loss of sense of smell and taste is very correlative of the disease. Today, it has been also published in academic papers. This changed completely the guidelines for doing COVID tests in Israel, which were before demanding a person to have fever. Behind the scene, our machine learning algorithms combining all positive and possible symptoms for COVID, identifying their correlations. And you can see things which are not even published today in academia, such as combination of dry cough and extreme fatigue, which are much more indicative than only fever. This system is deployed for 8 million patients daily in Israel, in the state of Odisha in India through our partners in Salesforce and Deloitte, and has been recently launched in the United States and Rhode Island. It supports multiple languages, English, Spanish, Portuguese, and we're continuing to add additional languages. And it can be up and running in a single day in a not anonymous form. So if there's anybody on the call here, we're donating the system, only requesting to cover our costs. If anybody there is in need, we're here to help, please do contact us. Tomer, back to you.
Thank you very much, Kira. We would like to move to the next company, but also for the companies, pay attention to the Q&A below, and you can reply them after our session. So the next company is Somatix. Somatix is a provider of wearable enabled remote patient monitor solution for the healthcare providers. I have here Oran Ophir, the CEO and co-founder of the company. So Oran, you can go ahead. The floor is yours.
Thank you, Tomer. Hi, everyone. My name is Oran. I'm the CEO and co-founder of Somatix. I'm based in New York. I'm the development center of the company is based in Israel. Somatix is providing remote patient monitoring platform to healthcare providers. We work with, in the US, with hospitals, with elderly care facilities across the care continuum, independent living, assisted living, subacute short-term care, and nursing homes. And we also work with rehab centers. Our solution is based on wearables, where we do gesture detection using wearable devices, through which we can detect all kinds of gestures. We don't need for that any other hardware to be installed or used in the environment, in the premises of the patient. We do everything by ourselves with a wearable device where we detect walking, sleeping, falling, drinking, medication, intaking, and more. And again, the user is completely passive. You don't need to install sensors, beamers, base stations, just using a wearable device with the patient. The system has 4 components. One component is the dashboard, the enterprise dashboard that the caretakers are using. Through that, they can see alerts, reminders, notifications, insights, and predictive analytics for all the patients, for each and every patient, and so on. There is a mobile dashboard, which is called a caregiver app, that is being used either by the teams, because as we know, the medical teams at the hospital or the elderly care facilities are not just sitting in one place. They are roaming throughout the facility. They are running around to provide service, and they use this caregiver app in order to provide the service. Also, the same app is being used by family members in cases where it's relevant, like with independent living or with patients who were discharged from the hospitals into their home, or they are just isolated or quarantined. So the caregiver app is being used by either the families or the caregivers. There is a user app for those users that can use it. In some cases, like if they are in nursing home or subacute short-term care, or in rehab centers, they cannot use the user app. But for the other users that are more independent or are just patients in quarantine, they can use the user app. And there is the wearable device. First of all, we are device agnostic. We can work with many different wearable devices, but 95% of our users are using our wearable device because it's lightweight, it's 23 grams, you can shower with it, its battery lasts between 4 to 6 days, so it provides everything that they need. And most important, it's very, very simple to operate. Again, you don't need to kind of operate it like you operate smartwatches that are more complicated, especially for elderlies. So the facilities that we work with, the way that they use our system is basically to keep patients safer at home and in long-term care facilities and reduce the need for hospital admissions, because the concern everywhere around the world was to reduce about the stress on the hospital system. So this system is being used in order to keep to monitor the patient's health, well-being, and safety from a distance, eliminating the risk to both the caregivers as well as to the patient. It's all based on AI, on adaptive algorithms that are working in the background in order to signify deterioration or improvement in the health patterns of that individual. The system also has a geofencing capability. So you can define safe zones that are being used in order to see that the patient is within that safe zone or has left it. And it also enables the connectivity between the family members and the patients, or the caregivers the patients. So there is a two-way connectivity, just to keep everyone to make that connection. We know that it's important, especially for elderlies that feel kind of deserted in the current situation, and it does other things like drinking detection and falling detection. Again, more related to the elderly's environment. And on top of it, we can, there is some kind of a problem with, and on top of it, when the healthcare providers are using it, they're also being reimbursed in the US using CPT reimbursement codes. So not only that they get all the clinical advantages, and not only that they get the efficiency of the teams that are working on the solution, they're also being reimbursed both by private payers as well as by Medicare, for example. So you can contact us. We are based again in Israel and in New York. You can see the contact email of the company. We'll be happy to provide the system. It's a remote deployment that takes less than 48 hours to activate. Thank you.
Great. Perfect, Eran. Thank you very much. We'd like to move on to the next company, Zebra Medical, AI for detection of COVID in chest CTs. We have here Awad Arazi, is the CEO of the company. Awad, you can go ahead.
Hi, good afternoon, everyone. I'm extremely happy to be with you today and proud to be on a panel representing Israeli innovative companies. I'm just validating you can see my screen. Everything's good? Super, let's keep rolling. So Zebra is on a mission. We're on a mission to transform patient care by teaching computers to automatically read and diagnose medical imaging studies. Now, medical imaging is already established as one of the most critical and influential domains in healthcare. I'm talking about the use of X-ray, CT, ultrasound, MRI, and other imaging modalities to diagnose patients. Over 3.6 billion imaging scans are taken across the world every year, dealing with conditions such as prenatal and breast screening, cancer detection, cardiovascular disease, chronic pain, acute injuries, image-guided and interventional therapies, basically everything. And the challenge with imaging is that the continuous growth in medical imaging volumes and complexity is that we're quickly reaching the human limit for effective interpretation of these images. And so Zebra is looking to empower healthcare providers to manage their ever-increasing workload without compromising quality of care through the use of AI and machine learning. If you look at it just from a sheer physics standpoint, one radiologist on average reads about 50 CT studies a day, and each study has 400 images. So that's 2,000 images, that's 20,000 images per day, which means that each radiologist spends about 1.6 seconds reviewing every image. And our AI solutions help radiologists by automating the interpretation of medical images for certain types of conditions. And really the way our technology works is we receive a copy of all the scans that are taken at a particular hospital, and then our software reviews the images and provides the initial diagnosis even before the radiologist has looked at the exam. So kind of think of it as like an autopilot solution in a long transatlantic flight. You wouldn't want the computer to do the takeoff on its own, to fly the plane for 12 hours in bad weather, and then to land it solo. But you're also very happy to know that it's there supporting the pilot who's alone on a long journey, right? So that's the relationship we're looking to establish with healthcare practitioners as we empower them to be more timely, more accurate, and to relieve their burden so that they can focus on where they can add the most impact. Now, in order to accomplish this, we're leveraging some strategic assets, including talent, and Zebra has the largest team of medical imaging AI technologists in the world. We're 78 people strong right now, with the headquarters in Israel from an R&D standpoint, and now building out our larger commercial presence in North America, where I'm based. A major asset for us is also data, and clearly, you know, anyone that understands machine learning and artificial intelligence, you recognize that your ability to have data and your ability to have that data with a full longitudinal record is what allows you to create and to train algorithms very quickly. You know, as Assaf Barnea noted earlier, I think having longitudinal records is one of the unique features about being part of the Israeli digital health ecosystem because of the HMO environment that we have. And so Zebra's working with a large data set from Clalit and from a very large provider in the US called Intermountain Health. And we have over 30 million patients with their full 10-year patient history, from the order to the images to the reports and to the codes and indications that were noted and the problems that were noted in EMR downstream. Another major asset and a big push, I think, for this entire industry is regulations. Zebra has 4 FDA-approved products, 9 CE marks. We have 3 products that are pending with the FDA. We've also been included as part of the FDA pre-certification pilot program, which is a program that's been open to a very small number of companies, including Verily, Apple, and a small subset of others, which essentially allows us to work more rapidly and more openly with the FDA to approve software-based medical devices. I think the FDA has been very responsive, actually, in terms of adapting to the AI revolution in healthcare. And we want to be there at the forefront of helping them shape the right regulatory processes to streamline this and to get products that can make a difference out to market as soon as possible, and to do that safely and securely. And then finally, research and publications are a big part of what we do at Zebra to validate the efficacy of our solutions. And that's, I think, in any new domain, you're going to have to start to build a large knowledge base of how this can impact change in a clinical setting. So let's jump in to talk about COVID. And you know, while most efforts to fight the COVID-19 pandemic to date have been on characterizing the virus, on testing, on vaccinations, or on building immunity against it, there's actually been very little to help the health systems understand the potential for disease progression in patients. And based on that disease progression, to therefore create the best care plan. You know, if you look at the greatest drivers for coronavirus-related mortality, it's often been the inability to detect early potential severe cases and provide critical care to those that need it most. So healthcare providers need automated tools to support triage and to determine how to best allocate ER capacity, ICU beds, and ventilators based on disease progression. I think Italy serves as a cautionary tale where frontline providers had to make very difficult decisions about who they think had the greatest need to receive treatment. So Zebra developed software for a machine learning algorithm that analyzes CT scans, and the software automatically detects and quantifies suspected COVID-19 findings while providing a lung burden score, which is basically a calculation of the percentage of affected lung volume. And this will enable providers to better predict the trajectory of patients with COVID-19 as a decision support tool for the allocation of ER and ICU resources. And so from a technology standpoint, we're leveraging a patented algorithm that Zebra had developed in the past for detecting ground glass opacities, GGO, which are an imaging feature of COVID-19 pneumonia, along with detecting pulmonary consolidation, which is another important feature of how COVID-19 manifests. And this patented technology provides segmentation of some predefined features in a 2-dimensional slice of a 3D anatomical image, including GGO. And you know, just I mentioned data. I think this is a good example of how our data assets allowed us to quickly revector the roadmap in the last 6 weeks to pursue this, because we knew we could go back into our database to find cases that had ground glass opacities, that had a pulmonary consolidation, and to start to train up the algorithm as we were still obtaining COVID positive cases to validate against. And so Zebra researchers and engineers have used clinical data from thousands of medical images to train the AI model for the COVID-19 solution. And as I noted, we're now validating that against confirmed COVID-19 scans from around the world. And so we're anticipating that our software will offer key insights into disease severity and enable doctors to diagnose, triage, and evaluate patients swiftly and effectively. And so ultimately, this delivers a faster, more accurate way to manage the COVID-19 crisis by quantifying the disease burden and by having a fast alternative that will support the triage process for the care community. And I believe this will continue to have significant value also post the COVID peak crisis, because we will continue to see difficult decision-making once everything ramps down in terms of its preparedness. We'll still see COVID cases in the community, and the ability to accurately quantify it and try to establish disease progression will help the care team decide how to allocate their extremely valuable resources. So that's what we'll cover for today. I'll just switch back to see if there's any questions on this, or back over to you.
Yeah, thank you very much, Rod. I encourage the audience to keep on sending us additional questions for us to answer for the companies. So feel free to ask more. We would like to move to the next company, ContinUse Biometrics, developing contact-free vital signs monitor solutions. We have here Asher Polani, the CEO of the company, to share his presentation.
Okay, so hi everyone, my name is Asher and I'm from ContinUse. I hope that you see the screen. We enable better health, safety and care practices through contact-free, simple and accurate monitoring solutions. And our focus groups are aging population that are increased in numbers, groups of chronic patients, mainly focusing on respiratory and cardiac conditions. This is what we did traditional in terms of development. And these diseases, with the multiplication of aging and so on, result in high personnel, national and global social costs. And if we focus a little bit on COVID-19, which most symptoms are related to cardiac and respiratory conditions, we're talking on large number of people. And the idea of doing contact-free monitoring of these people, of course, will help reduce costs and improve the quality of service. So traditionally, people with such conditions would go to the clinic, to the hospital, or to the ER. But this is moving over to be treated from home. And when we come to home, it needs to be accurate, it needs to be reliable, it needs to be convenient, such that we'll be able to detect early enough situations of deteriorations and changes, and not just when I don't feel well. Let's try to detect it slightly before I feel bad. So if we look a little bit on COVID-19, we see that everybody speaks on fever, but only 44% of the people that are being hospitalized are having fever. But if you look at other symptoms like coughing and rapid breathing and so on, these are symptoms which actually creates the deteriorations of the situations. As you know, the virus actually ends up with deterioration of these situations, and this is the more costly and more hospitalized need kind of patients. So what you need is a contact-free multi-parameter sensing device that will detect those conditions from distance, protect the staff from one side, and will help the person at home or coming to the clinic in terms of follow-up and tracking.
Providing continuous medical care to those who need it is currently expensive and inefficient. We need to make healthcare more affordable and accessible to all, and to extend the clinic's reach into the patient's homes. Here, at ContinUse Biometrics, we do exactly that, making it extremely easy for people to get access to continuous medical monitoring everywhere, through remote, non-touch, and effortless sensing. What we are providing is a revolutionary solution for patients suffering from various chronic diseases, such as cardiovascular, diabetes, and other respiratory conditions. Thanks to our sensors, which are incredibly easy to use, patients will get monitored passively throughout the day without changing their daily routines. The system collects and uses AI techniques to analyze data and alerts patients as well as physicians in case of deterioration. Providing that kind of preventive care improves quality of life and can save patients' lives. Here at ContinUse Biometrics, we are enabling better healthcare everywhere.
So information are being detected remotely without touching the person, with their clothes on and so on. We don't care whether they are driving or in home or at the medical institutions. All information goes to the cloud where we do the trend analysis, analytics, detecting certain biomarkers that represent situations of these people. So the emphasis is on analytics, but the convenient way is how, or the main thing is how we collect information. So these are different use examples. People that are at home. On the left side, you see a tabletop offering. We have a clinic offering. We have a telemedicine offering where it's combined with a telemedicine service. And as I said, also, it can be integrated into a moving car for detecting same symptoms and so on, mainly for professional drivers and so on. In terms of the business model, it's a two-tier business model, B2B2C, where we partner with consumer electronics groups to provide an enabler, meaning the sensor, either embedded or as a standalone basis. This is augmented with services that provide tracking, analytics, and remote care support to the end user. It's a very simple thread through B2B2C concept. And this is in a nutshell what we do. I'll be happy to answer questions now or later on. You have my details on the screen, and I hope to hear from you. Thank you.
Great, thank you very much, Asher. We would like to move on to the last company of the day, TailorMed. They have the patient financial navigation process system. We have here Srulik Dvorsky, is the CEO and co-founder of the company.
Thanks, Tomer, and thanks for inviting us to share what we are doing in general and specifically for this unique situation that everybody is going through. So as Tomer mentioned, our focus has always been around the intersection between healthcare and finance, and more specifically how patients are supposed to be affording their care. Unfortunately, this has been something of a growing problem in the last few years. The way that we have kind of structured our thinking around the problem comes from two different perspectives. The core of what generates this challenge is the fact that patients, especially in the United States, are experiencing very high financial constraint and very high out-of-pocket expenses when it comes to their treatment and getting care. And that creates a problem that has, at least two sides to it. One is patient's financial toxicity. And this is a term that basically tries to describe sort of a side effect of the diagnosis that is related to the financial implication of having very high out-of-pocket expenses. It is obviously impacting patients and their families when it comes to their financial health. But also, it has been reported and studied that there are also poor clinical outcomes when it comes to the implication of those severe financial challenges. It is very prevalent in high-cost conditions like oncology, MS, but also people with chronic conditions and other critical conditions are suffering from that as well. On the other hand, we have healthcare providers that in the last few years have seen a dramatic increase of their uncompensated care or debt as a result of the cost-sharing dynamics between patients and their payers. Basically, nowadays, about 25% to 30% of provider revenues are expected to be collected from patients that, simply put, don't have the ability to pay. And that creates a real challenge for both those, I would say, stakeholders in the ecosystem, the patients and the healthcare provider. Unfortunately, the aftermath of the COVID-19 pandemic is actually intensifying this problem, both for patients as a result of higher unemployment rates, which leads to lower income and also a higher rate of uninsured patients. And that's basically means that patients with existing conditions that have financial constraints and also patients that are now affected by the COVID pandemic are seeing a significant increase in their inability to pay for the care that they need. Alongside that, we are seeing a hit on provider revenues. During the acute phase of the pandemic now, we are seeing a decrease of elective procedures at about 50–60%. And also, there is a significant financial hit to a lot of healthcare providers, from small clinics to very large health system. Given that and what's coming ahead with patients with lower propensity to pay, there is a threat to financial viability of those institutions. And also what we are seeing is that the landscape is changing. We are starting to see more options that patients can leverage from when it comes to financial assistance, governmental relief funds, ways to optimize for better insurance coverage. And all of that together creates a real challenge on the one hand when it comes to the patient getting the care they need and being able to afford it, but also to healthcare providers to try and navigate the entire space. What we're doing is a software platform that basically has 3 pillars to it. And the core is our TailorMed financial navigation system. Basically what we do, we digest data from EMRs and billing systems. We project out-of-pocket expenses throughout the patient's episode of care. And along that episode of care, find opportunities to offset or completely eliminate the cost for the patient. To give you a few examples, pharmaceutical companies provide copay cards to finance the copay side of the patient's responsibility. Governmental funds, insurance changes to have a better insurance, even if you have pre-existing conditions, and also charity programs on a nationwide or local level. What the system then does, it finds the option for the patient, enrolls the patients to the program, and then helps the provider and the patient, because if we are helping the patient, they pay less, and if we are helping that, the provider increases the revenues by not counting on the patient collections. We have a strong analytic and reporting module that is called TailorMed Financial Insights, basically allowing the health system to understand the impact of what's going on within the practice and how many revenues and patients they are able to assist. And the last is a dedicated module for pharmacy that deals with the ordering of those drugs. What we have done in light of the COVID pandemic is that we understood that on the one hand, the very basic problems on top of which we have founded the company have been intensified. But on the other hand, we are seeing the inability of patients to come into the clinic, get that service of financial counseling and financial assistance. And a lot of our teams that we are working with in hospital settings have been working from home without the ability to deliver that service to their patients. So we identified that gap and adapted our enterprise platform to a remote navigation platform, basically bringing telehealth to financial navigation. And to put it in perspective, it basically means that as a private practice or a large health system, you are now able to deliver a consultation call or a video call to your patients, guiding them through the expected out-of-pocket expenses they would have, and also give them actionable tools to reduce those expenses and basically remove the barrier to care, which is very significant when it comes to financials, especially in the United States. So we have adapted the enterprise platform to have a zero uptime, zero IT upfront issue, and basically have the core capabilities of our platform, which means benefit investigation. We are working with payers and clearinghouses to identify if the patient's insurance is currently active or not. We are finding financial assistance for COVID specifically, but in general for diabetes, COPD, MS, oncology, and others, and basically helping them automate the fulfillment of those, the filling of those forms and capture the funds for the benefits of both the patients and the severe financial impact on providers. Our services also include remote consultation visits and even the ability to follow up with the patient afterwards. And already we have seen a dramatic increase of patients that are going into our system. Our existing accounts are working from home with this setup, and new accounts are starting to arise in order to try and mitigate both the bleeding of revenues, but also to help their patients. To give you some feedback about the impact, so far we have approved north than $100 million in funding, which basically translates to about $30,000 on average per patient. This is something that is very profound for patients, but also the metrics related to the revenue and basically direct bottom line influence on providers is something that you need to kind of take a look at. On average, $2,500 are saved or increased in revenue per patient that is going through the system and gets an approval. We're taking teams that have previously worked manually, and once adding the technology, we're helping them to do basically two things. First of all, with automation to increase the number of patients they're able to secure funding for, but also with the predictive analytics that we have, we are able to take like thousands or tens of thousands of patients and service only the subpopulation of patients that are in financial risk, so they know who to target first and alleviate those financial concerns even before the first cycle of a treatment. So that's very important. Also, the timing of that intervention. To give you a glance of how it looks like, basically, a patient case is presented. We are showing them the like treatment protocol and the medical journey that we derived from the EMR. We are showing the financial responsibility that is specifically calculated for that patient, giving their benefits, and then how many programs we have found that can reduce those costs for those patients. In this screen, they can see the specific pharma company programs, foundation grants, local charity groups, and then enroll through the system and eventually have a top-down view of how many patients got assistance, how many revenues were collected, and how many benefits they essentially were able to capture for the sake of their patients. I think that what we're seeing now in the acute phase and what we're expecting to have after the pandemic, I wouldn't say end, but kind of is settling a bit, is that the need for patients to have financial assistance and financial opportunities to finance their existing and future medical conditions is becoming more significant in the past, and we're trying to do that with both the remote navigation and our existing platform. We'd be happy to share more, and you can check out our website, and questions now or afterwards would be welcome. Thank you for the opportunity and stay safe.
Thank you very much, Srulik. I want to thank you all for joining in and hope that you benefited from this webinar. I want to thank you especially for the colleagues from the Israeli economic missions globally, from the embassies and consulates for the partnership in promoting the webinar. Thanks also to Assaf, to Angela, Tomer from the Israeli Expert Institute and the other friends. And kudos to Kira, Asher, Eran, Oad, and Srulik for your impressive systems, and thank you for the presentations. There are clearly additional wonderful examples of the thousands of technology companies in Israel that you could collaborate with and that could help you to be better and more efficient in your job. We will be delighted to introduce between you and them, and as long as it may interest you. In this context, Israel operates 44 economic missions globally. These missions are non-for-profit organizations that are aimed to bring together Israeli companies with global partners. Together with the Israeli Expert Institute, we also partner with the embassies, consulates, and Chamber of Commerce. Please feel free to reach out to us from the country that you are based to explore thousands of Israeli startups and companies offering innovative solutions. In addition, we welcome you to visit our global web. I would like also to remind you on what Assaf shared with us. We have the Israeli Innovation Authority has, I would say, dozens of bilateral MOUs with states and corporations, and you could take advantage of that. And of course, anything which got to do to the US, the Bird Foundation is very incremental. Last but not least, our sincere gratitude to all the first responders, the essential workers, as well as the entire medical ecosystem. We respect and appreciate your commitment and hope that we will continue to be healthy and resilient as we explore ways to develop and expand our partnerships. You could see in the screen the names of my counterparts in the US and South America. Feel free to touch base with them. Thank you all. The webinar will be still open for a couple minutes. You could send questions to the panelists, and please be with us in future events that we and the Israeli Expert Institute will do. Thank you very much.